Hi, Jen. Hi, Amy. Hi, Kendra. I think I've got everybody that's not a note taker in. Okay. I will go ahead and remove the faces from those who won't be speaking, and I will get started here in just a hot second. Okay. If anybody has any friends who are trying to join on and they're not getting in, make sure to let me know. Just send me a little message and I will be paying attention to that. Okay, feel free to use the chat as much as you would like to. I am a nosy Nelly. So put in the chat, what is your go-to comfort food? And maybe I will have that for dinner today because I still have to figure out what's for dinner. But let's chat just for a second about our sponsors. Have kind of an order of things that I want to chat about, and we are so excited for Lauren's webinar today. And I'm so pleased to have her on today. So let's first thank one of our sponsors, Practice by Numbers. They are an all-in-one cloud-based platform built specifically for dental practices that want more clarity, efficiency, and control over their business. Instead of juggling multiple systems, they bring everything into one place. Real-time analytics, patient communication, scheduling insights, and call tracking and performance reporting. If you are someone who wants fewer tools, better visibility, and systems that actually support growth instead of adding more work, Practice by Numbers is absolutely worth checking out. And I'll drop in the chat here if you would like. Go ahead and check out that link for me, pretty please. And because, of course, we have to make sure that we have all of our I's dotted and our T's crossed today for the continuing education credits. At the end of this webinar, you will have a link to a survey, which is where you will give us your license number for your continuing education credit. You'll submit your personal email address that is unique to you, not an office email address. And if you don't need continuing education, please fill it out anyways, as we are doing our best here at Career Elevation as hosts for these speakers. If there's anything that we could be doing better, we want to hear from you. Also, if we're doing great, let us know that too. So feel free about that. Okay, Lauren, if you want to flip over to the next slide. That is me. Okay, so at Career Elevation, I am the owner here at Career Elevation. We do dental specific recruiting for dental offices as well as dental companies. The main thing that we're known for, besides continuing education right now, is done for you recruiting. We also help with candidate placement. We have a VA agency. We make hiring easy to find your elite team members. So now you can flip over to the next one, Lauren. And this is the magical list of all of the webinars that we have scheduled this year. So go ahead and take a screenshot. I will put a link as soon as I'm done talking in the chat so that you can go sign up for any or all of them. It is the same spot where you had registered for this course, for this webinar, but I will put the link in down below as well. Okay, Kendra, I would love to see your beautiful face and have you talk for just a second, just a minute for introducing Wisdom as another one of our sponsors today. Now, does it work? Sorry. There we go.
Perfect. Yes, now it works. Hi, everybody. My name is Kendra. I'm here with Wisdom. We are a dental billing company or revenue cycle management. Same, just however you refer to it. I manage partnerships, and so we're super happy to sponsor one of our lovely partners, Wendy, today, as well as Lauren, one of our beloved hygienists, dental billing experts, and she's also a sales director here. So we're super happy to be here and also at the next series of events that Wendy has lined up. So Do you want me to go ahead and do the special now, Wendy? I'm so sorry.
Yeah. Go ahead. Yes,
So
feel
for
free.
everybody who's attending, if you do need help with billing in your office, we have $1,000 off your first month for being a partner or participant here with Wendy today in Career Elevation. And we'll also have a freebie to download at the end of Lauren's presentation today. So thank you guys for having us.
Absolutely. Okay, and I just put that into the chat too, so everybody can take a look at that. Now, we're all waiting for Lauren's introduction, right? We are so excited to have Lauren speak with us. And thank you so much, so much, so much to our sponsors, Wisdom, as well as Practice by Numbers. They are the ones who really make this show happen. And you, as the attendee, you're the reason why we're here today. So Lauren's life started in dentistry when she was 15 years old as a reluctant assistant in her father's practice. Since then, she's worked through every corner of the office, from insurance coordinator to the hygiene chair, building the skills to truly lead. Known for her extroverted nature, which you're definitely going to see here today, and her love of authentic connection, Lauren brings meaningful rapport to every patient interaction. When she saw the opportunity to help practices thrive through wisdom, she knew she had to be a part of it. Today, Lauren focuses on the business side of dentistry with one clear goal: helping doctors get compensated fairly through streamlined systems. And today, we're going to be focusing on the Perio system. At Wisdom, she's not just improving collections, she's honoring her father's legacy by helping both patients and practices thrive. Lauren, take it away.
All right. Well, thank you so much, Wendy. Yes, I'm really excited to get to dive kind of right into helping you guys build a periodontal protocol for your office. But before I do that, I wanted to kind of take a step back into the past a little bit. So one thing, in looking back through the past, for years, you may have heard doctors talk about this, but a lot of practices operated in what could be called, kind of the golden age of dentistry. So around the 1970 to 1980s, the field of dentistry was exceptionally profitable and straightforward. So dental insurance had just become a standard workplace benefit, and PPOs had not taken over. Those lovely PPOs. Even more promising, dental materials were advancing, and innovations in technology were not far behind. So it made me wonder, with the rapid pace of the technological innovations in dentistry, and even just with the education and really the link and even the medical field getting, their hands in how much oral health, relates to systemic health, it got me wondering maybe why is now not considered the golden age of dentistry? A lot of clinicians are super excited about innovations in our field, but one thing we've also noticed is that there's a more challenging shift that's also occurring, and that's the rise of the economic pressure. So the burden is really becoming almost impossible to ignore, and I fully believe it's hitting the hygiene department harder than ever before. So you've probably talked, there's a big talk a lot about hygienists, trying to find a hygienist. Today, it seems like practices are caught in a tightening squeeze. Labor shortages have driven hygienists' pay to record highs. And don't get me wrong, I'm a hygienist. I believe we should get paid for what we do. But a blessing of being able to work for my dad is I got to see another view of the stress he held as somebody who ran the office, the payroll, the overhead. I believe one of the biggest issues is insurance reimbursements continue to stagnate or decrease. So our solution is we have to work smarter, not harder. So in this environment, in this, economic squeeze, the path to profitability or even sustainability isn't about just seeing more patients. So I think too, and this was very real for my dad. It was always, we need more patients, we need more patients. And that is true. I think that's a very important part of growth, but it isn't just about filling your chairs with new patients. So the missing link, I believe, to surviving these economic shifts lies in your periodontal management protocol. So simply put, kind of bluntly, put, you really cannot afford not to treat periodontal disease anymore. I have a lot of hygiene friends, and I believe a significant amount of us got into the field to help people get healthy. So my question to all of you is really taking a look at the patients you see in your chair, and are you truly seeing disease right in front of you? To understand the health of your practice, you really have to look at the periodontal metrics that matter. So the ratio of periodontal codes to hygiene codes. This gives you a really good idea on, are we successfully treating periodontal disease? So the healthy standard, in my opinion, is when you're looking at the periodontal codes versus the prophy codes. So in a healthy performing office, periodontal therapy should account for a minimum of about 35% of all of your hygiene codes. The warning sign. So if your periodontal production is below 20%, your practice probably needs some immediate intervention. The biggest thing is do not panic. It just can be kind of an opportunity to make some changes within your practice to get you guys to a place where you're not only treating health, but you're helping your production. So if you go back, I encourage all of you to, after today, really look at your numbers. And if you happen to fall below, in that warning sign, it is opportune time to realign your hygiene department diagnostic philosophy. So it's time to kind of recalibrate with your team and start treating periodontal disease. Easier said than done, I'm sure. So what I typically find is falling below this benchmark can be a sign of underdiagnosing. So many clinicians fall into the trap of performing bloody prophies. I don't know about you, but I am way too ADD to do the same thing every single day. So if I were having to do, those bloody prophies, which take a toll on your body, I think that would be my nightmare. So the ability to have just a really great periodontal management protocol also gives you the joy and reignites the passion, I think, on why many hygienists even got started in the field to begin with. So treating active infections as just standard cleanings does put your office at risk. It's way more than just a financial leak. It's an ethical and it's a liability issue. So every time an infection is ignored, the patient's health does suffer, and potential revenue is just walking right out the door. So that's where I truly believe work smarter, not harder. So with this being said, I think, and this was even for me, we knew we had to make a change, but we had no idea where to begin. So I had Kendra Sellers, who is just my guru. She ignited a significant amount of passion in me years ago when she helped us create a system. But the most important thing is realizing that successful implementation is going to require a mindset shift. I was never about chasing money. I never worked upon production. So for me, it almost felt like I was selling my soul if I was just worried about the sales. So that's not ever what I'm trying to teach. It's not about chasing the mighty dollar. It's about improving health by having a system and educating your patients. So to move this bar, we must first stop by diminishing the disease. I like to be liked. I don't know about you guys, but I like people to like me. People pleaser to, to the infinite. But one thing I realized I was doing as I was talking to my patients and using really soft, non-threatening language of, there's a little bleeding here, there may be just a little bit of a deeper infection here. It was because I didn't want to make anybody upset with me. I had to get over that. I had to realize that I had to call it for what it was. It was infection and it was a disease. So I know my dad was similar, and I believe there's many practitioners out there who often hesitate to diagnose out of fear of rejection. The reality is, and I really had to accept this, the reality is that our patients already said yes to us. They were sitting in my chair because they trusted us and they trusted our expertise. So I really had to have that mindset shift of realizing that if I was failing to diagnose and treating their disease, I wasn't being nice. I was actually breaking their trust. So if the clinical need is there, then why do we feel like the diagnosis gap is so large? I believe it's not a clinical skill issue or even a desire. I really believe it's a lack of systems and a lack of time. I think when you get in the habit of, you can talk to a lot of offices out there and they're booked 6 months out, which is a good, bad problem, right? But if you are not able to take the time to really align together and have a system in place, then you will continue to see the same type of appointment. You will continue to leave feeling burnt out. Burnout in dentistry is very real. So that is something that I think in taking the time, really aligning and creating those systems is going to change your office. So how do we do this? First step, I love taking kind of step by step because if you hand me everything, number one, I don't like change. You can ask my sister. She would always have to pull me aside and calm me down first and say, hey, we're going to change this. My eyes would get really big. So the Perio to production system can be taken in steps. And that is really what I recommend because I think in having the best intentions, as you all know, if you leave a conference, you are hyped up, you are ready to make changes in the world, but things tend to maybe fizzle out because you aren't taking the steps. So in taking these steps, I think the first step that is crucial is having that alignment and education. So calibrating the entire team on what constitutes a periodontal diagnosis. Making sure that you have verbiage that matches also your diagnosis. The second step, this is where it's going to take a little bit more time. I think it's an important part to implement your whole team as well so that they feel like they're a part of the solution, but you need to outline a periodontal management protocol for your office. So whether it be you block out a 2-hour meeting, I think that's a 2 hours very well spent, but decide what the standards are going to be for your office when a patient presents in your chair with disease. Be very precise. I'm going to show you an example later of my periodontal protocol, but be as precise as down to the millimeter so that everybody aligns. Step 3, how are you going to implement this with the patients? How are you going to get your patients on board with this new journey that you want to take them down? Visual evidence is going to be key. So utilizing your intraoral camera, again, my first answer is always no, I can't do it. Because again, I don't like change. But we started slow because we realized when we started fast, everything failed. So we had to learn. So implementing your intraoral camera, if you're not doing that right now, then even creating some type of competition, some little reward. Everybody likes to be rewarded, but making sure that you are utilizing your intraoral camera and you are showing your patients their infection. It's really going to bridge the gap between hearing the diagnosis and truly understanding it. So educating patients so that they own their disease and they are a part of getting back to health because we're not the ones that put them there, but we can help them kind of get back to a place of health. So another big important step here is hygienists setting your doctors up for success. I always will joke, I loved working with my dad. We did have our moments. And one of our moments was when poor dear Kendra came and we were setting up how we were going to do our consultations with the hygiene and doctor. We failed many times before we got it right. But I do believe it is crucial for the hygienist to set up the doctor before he or she even comes in. So before they enter your exam room, have your intraoral pictures taken and your concerns addressed and shared with the patient. Of course, I can't diagnose. I'm a hygienist. I would want to always help co-diagnose. So that verbiage is super crucial here of making sure, this area looks suspicious. This area looks suspicious, but we're going to have the doctor come in and verify. Lastly, The last step in the perio to production system is clinical coding. Make sure you are coding for what you are doing. If you are scaling and if you are removing tartar, if you're treating infection, if you are treating periodontal disease, use the appropriate codes. I'll go into this a little bit more of using the appropriate codes, but then how to set up for success on the other end of getting these claims paid. Calibrating probing. I hated this one because I don't like to be watched because then I get nervous. But I would say it is an important step in making sure everybody is on the same page. So going in with grace, going in with realizing everybody is on the same page is an important part of this. But calibrating your probing is important. I mean, we would even have to where we would send to a specialist who would get significantly different measurements than we would because we worked so hard on this. So one thing in regards to calibrating your probing, I know when I started, I was probing the line angle. You don't want to do that. You're not going to get the right measurement. So making sure that you're reaching the caul, that you are tilting that probe underneath the contact point to reach the caul area. Failing to do that is going to give you inaccurate measurements. So when you have even a team of, say, 2 hygienists and a doctor, if you guys are all measuring different, you're going to be giving the patient a different story of where they are. So this is the first step I really recommend before you kind of dive in any further is really getting together and calibrating together. And do it nicely, of course. So I promised you guys I would share with you guys an example. This was my periodontal management protocol. I look at this and don't think it's overwhelming, but I've had few people disagree with me. But I just like to kind of see it span out. And as we all know, in hygiene, in the dental field in general, it's not always black and white. There's going to be a lot of gray areas. So I'll show you kind of where more so my gray areas are. But if you are close and your goal is to help your patient, then you're doing a good job. So gingivitis, this is where, 1 to 3 millimeter pockets, maybe a few areas of active infection. I would keep them usually on a 6-month recare appointment. Depending on how much active infection they would have, I would go ahead and implement laser bacterial reduction. Always, I know insurance does not contribute to that. So I was very transparent with my patients, which I think really helped build that trust. So it's always was their choice. But I let them know, insurance typically does not contribute to this. This way it'll go through, it'll kill the bacteria, and then I can go ahead and do a cleaning from there. And my patients typically said yes. Moderate gingivitis, extreme gingivitis. This is really my gray area. This one, we would have to pull each other aside all the time and kind of go after the fact of what would you have done here? What would you have done here? So moderate gingivitis, extreme gingivitis. These are my patients who 3, sometimes even getting up to the 5 millimeter pocket depths, active infection. Now with 5 millimeters, some people are like, no, hands down, that is perio. But I would have college kids that would come in who would be honest with me and say they maybe brush once a week. I would see no radiographic signs of bone loss. So for me, I treated it a little bit differently. I would go in and make sure to code out what type of cleaning I was doing. Would I use the laser? Of course. Sometimes at a 5 millimeter pocket with rolling infection. Would I use laser assisted bacterial therapy or periodontal therapy? I would. Again, being very transparent and what I knew insurance wasn't going to contribute to. Now, when it comes to your early periodontitis, so that is where there is evident bone loss. That is where maybe it is isolated scaling and root planning with laser-assisted periodontal therapy. We always did those hand in hand because I just got better results. On occasion with the extreme gingivitis, I would see a patient who would come in and it had maybe been 10 years since they'd been cleaned. So one of the things in being a hygienist that I did not like is I didn't like to make decisions on the fly. I like to be prepared. Turns out I have some control issues. So what I would do is, because we had wisdom, we had excellent insurance verification breakdowns. And so the notes were in there. So as a clinician, I would be able to see a full mouth debridement, which that code actually changed in 2023 to be more about getting accurate periodontal measurements. So I started using that code a lot more. A lot of times that's allowed once in a lifetime. So I like to be prepared. So I would have an idea. I'd look, if it had been 10 years, I didn't see bone loss, in x-rays 10 years ago. Granted, a lot can change in 10 years. I took the x-rays. I didn't see evident bone loss there. I went in. I knew that they were eligible for a full mouth debridement. Boom. I went ahead. I was able to see them that day. I delivered a treatment plan. Even if I would deliver it as insurance would contribute, nothing. It's all about the education, all about explaining to your patient, and a lot of times they would accept that. Of course, going into when a patient clearly has periodontal disease, 5+ millimeter pockets, chronic perio, mobility, gingivitis, calculus, furcation, recession, I would always align my laser-assisted periodontal therapy with my SRP, and I would have that conversation with them up front that they're no longer considered just a general cleaning, that they have periodontal disease, that we can maintain that disease, we cannot cure that disease. So I set them up for success by letting them know it is super crucial. I see you every 90 days. It takes about 90 days for that bacteria to get destructive and can destroy more bone. So that is why I see you every 3 months. And I also let them know that a lot of times insurance is only going to contribute to 2 of those because they aren't necessarily worried about your health, but I am. I'm your clinician. We want to keep you healthy. So having all those conversations up front, I think, is crucial. When it came to our severe periodontitis patients, we knew when to hold them. We knew when to fold them. If I had patients that had 6 millimeter pockets, we did scaling and root planning. They still had 6 millimeter pockets, 7 millimeter pockets. That is really where we're going to get a specialist involved because they need a little extra help. So again, this is my example of the pretty extensive periodontal management protocol that we had so that everybody had a blue book that they could follow as closely as they can if a patient presented with certain things in their chair. Explaining the numbers. Even though, especially if you get to those anteriors and you start, calling out 2, 2, 2, 2, 2, you sound ridiculous. But it is important that you explain the numbers to your patients. So explaining that a healthy measurement, 3 millimeters and below, you can reach the bottom of that gum pocket, typically clean that out. Anything above 3 can get very challenging to keep clean. Oftentimes, bacteria will just kind of sit in that gum pocket, fester, release toxins, destroy bone. So having that conversation up front and having them listening to those measurements that you're reading out loud makes them even more a part of their health journey. This one's my favorite. I love pictures. So capturing that active infection. And if you notice, I'm always going to call it active infection. I had to almost take it out of my vocabulary, a little bit of bleeding. But one of my tips that I like to do is if I know a patient just has, a bulbous tissue, it's going to be unhealthy. I'm going to take my Explorer, my 204S, I'm going to run that along that gingiva and healthy tissue. Of course, you're not going to have that rolling infection. But when you do, boom, take a picture, put that up on the screen. That is super crucial in order to get your patients involved. And you may notice that as soon as they see that picture, their first words are, how do I make that go away? So they're already kind of sold on their treatment of how you're going to help them. Then you kind of look to be a hero because you truly are trying to help them get healthy. So anytime I go through and I've done my periodontal measurements, I've taken any of my pictures, I'm going to lean that patient up. I'm going to look them eye to eye. I'm going to have a conversation. Here are my areas of concern. Here's, I think, the steps that could help get you healthy. But I always let them know I need your help in this because as much as I like to think I'm magic, I'm not. I can do what I do, when they come visit me, but it is so important that what they do at home, I let them know that they really do have a significant amount of control in regards to getting healthy. And going back to that handoff is important. Handing off to the doctor so they heard it from you. And it's just beautiful, beautiful, beautiful when the doctor comes in, says the exact same thing. And then, of course, when you leave, you say it again so they not only hear it once, twice, but 3 times. It just is going to help with that trust. It's going to help just showing that expertise that you have, that you know exactly what you're doing. Proper coding. Of course, at Wisdom, we are learning the ins and outs of the changing codes all the time because insurance loves to change its rules, different attachments that need to be set. But making sure that every office really has an updated CDT code book, I think is really important to understand how they should treatment plan and how they should diagnose and which procedures need to be done. Supporting your claims. So one thing that I liked to push against with my lovely baby sister, who was technically always my boss, is there's just too much for me to do. But it really is important to realize the success of your claims getting paid happens in the back. It happens in the clinical side. So really making sure that you're supporting your claims. My dad retired, a new doctor took over, and all of a sudden, all of my SRP claims were getting denied. I changed nothing in regards to me trying to co-diagnose on who needed SRP, but all of a sudden the denials were coming in. So I got frustrated. And so I came up with an SRP checklist that I would have. I would template my notes so that no SRP claim went out unless that checklist was done. And a great thing as a thank you guys for, coming to the webinar today at the very end is I will give you my SRP checklist because getting those claims paid is a challenging thing. And you probably, anybody who works admin or talks to them knows that fighting insurance claims is not getting easier. It is getting very difficult. And we can really help support by having those crucial attachments available and having that checklist. So on our end, as hygienists, as clinicians, production is crucial. But production is crucial. I also believe collections can be just as crucial. So I love the saying, production is vanity, collection is sanity. To ensure the practice actually sees the rewards of its work, I really believe every office needs to have a bulletproof claim submission and collection system. A lot of offices are fully capable of doing this themselves. You don't have to. I know that when my sister went to go stay home with her babies, our systems fell apart and we were drowning. So when she came in with Wisdom and really, she was able to get our collections back up to 98%. It was beautiful. Dental billing is a million jobs in one, and the systems were not built with practices in mind. So if you guys do not have, if you're a hygienist and you get to hear every so often, I'd encourage you to sit down with your admin team and really start to understand how difficult it is. Insurance is not making it easier. A lot of outdated processes, the ever-changing policies with insurance and disconnected systems really put a burden on everybody's shoulders. And the person who feels it the most is going to be the doctor because you guys, we're producing, we're clinicians, we're doing our best, but it only matters if the collections are coming in as well. So even though your team may be doing everything right, the uphill battle does continue. I love Wisdom, obviously, because I got to live it. I got to live working with Wisdom and their amazing systems. So outsourcing offers a chance at relief, an opportunity to gain a partner fully committed to making the practice stronger. We were a very close-knit family practice. So once we had my sister save us again, we were able to give presence back to our patients. We were able to really look at our case acceptance again, our specials again, getting new patients again. So of course, I am just a firm believer in outsourcing and how much amazing work that they can help with the office. different signs that may show that you may need some support. I love the numbers. I knew if I was ever going to talk to my dad about anything, I better have numbers. So if you ever talk to the team, in the front and they're talking about how the insurance AR is creeping up, especially past 30 days, if claims are followed up on sporadically, which again is not at fault of the team because you sometimes have to wait on hold for 45 minutes and that's just for one claim. It's really not getting easier. Denials get ignored. Their biggest hope is that you don't have the team and you don't have the time. And so that is why I just love getting to work with offices now and be able to say, there is another way. We can absolutely help you. And that if any of you guys have that one person in your office right now who's owning billing all alone, please go give them a hug. They need a hug. And tell them that there is another way and it has nothing to do with their lack of skill. It has to do with how it's set up. So Wisdom is always here to help. We love helping offices. One thing, like I said before, if you guys want, you can scan this QR code and I will get you my SRP checklist because that is a hot one right now that is getting denied left and right. The other thing I really love to do with offices is offer a free practice analysis because what that does, it's really easy to fill out, but it allows me to see if there's any missed revenue on the table and why. It helps me take a look at your adjustment percentage. It helps see why you guys may feel like you're working so hard, you're kind of drowning, you're treading water, but the doctor maybe is like, well, the numbers don't make sense. The numbers don't make sense. So if you want to set up some time with me, I love to show offices a practice analysis. And I have yet to do one where there's not missed revenue on the table. And I can typically, cue into exactly which system maybe needs help over the other. So thank you guys so much. Feel free to reach out to me at any time. If you guys do run your periodontal codes and it comes up in less than 20%, again, don't panic. Don't panic. Reach out to me. I'm happy to guide you through. I'm happy to help. But start with calibrating your team and changing that mindset.
And this is the 100th time that Lauren has given this webinar. Absolutely just kidding, but dang, girl, you rocked out. There were so many times that I was like, I don't get a lot of, because I'm not a hygienist, but I don't get a lot of the references all the time, but you made it so simple, so easy. I love it so much. Stephanie said that we can't get the SRP. Stephanie, can you double check and see if the link that I put in the comment is correct? Maybe I accidentally put the wrong one in. If that's the case, then I will do it. But see if either the QR code will work or if that link will work. Let me know. So Lauren has done a beautiful job for us today. We are to the Q&A part. Please think about any questions that you'd like to ask her and send them to me in the chat. Jen, thank you for letting us know that the QR code worked for you. So I want to make sure that you are going to go back to your patients, to your office, and make an impact from today's webinar. Lauren was a fantastic speaker for us today. So please take out a piece of paper and a pen and write down your MIT, your most important thing from today, and go back to your team. Share the video with them once you get the email afterwards. And also share the resource from Wisdom as well, the one that is in the link. And it will help I've already looked at the resource from Wisdom. It will help the hygienist, the dentist, the front office team members. It will be a great help for each of the departments within the practice. And in like 5-10 more minutes, I will put the link to the survey down below and give you that piece of information. But as the questions are coming in, we'll do the questions and then I'll pop in with the information for the survey in just a second. Renee said, do you use 4346? We get it covered in public health.
I do use 4346. I do use that. And I am sending everything with that claim. I am sending the intraoral photos. I'm sending x-rays. I'm sending my clinical notes.
Beautiful. I think she might have come in just a smidge bit late, so she might not have seen that screen that you had all of the different codes in. And I honestly didn't look at to see all of the numbers because I haven't been in an office in a hot minute. But let's see what other questions are coming in. Why do you think SRPs are being denied more often?
So my first answer, so Wisdom's tagline is dental insurance sucks. So I like to go in first with that, but I have to be honest. It's not fully on the insurance. So I do believe there are some offices who maybe were not submitting true claims that should have had SRP. So those 4 millimeter pockets, if there's no evident bone loss, in my opinion, that's not SRP. So I think for a while, and just talking with other offices and different things like that, that may have been done. So I think insurance has had to get more strict and required more documentation.
Beautiful. Okay. And can having a strong perio protocol help with patients keeping their appointments, or do you think it might hurt?
I'm going to go with the first. So I was able to live this out. My periodontal patients were the number one patient who never no-showed for an appointment, and who set up, because I would also set up their 3 and their 6 month. So I have both of those set up because I always wanted time for them. So I think that extensive education in the beginning of we're going to partner together to help get you back to health. They really took it seriously, and they also invested in themselves because every insurance is more of a coupon. So they really have to make an investment in their health of maintaining the disease and it not progressing. So I believe that really did have an impact on why my periodontal patients were my best patients.
That's awesome. All right, another question here. Do you think hygienists should be responsible for discussing financials when a perio code is not covered? We're getting kickbacks that they do not have the time nor should be responsible for that, even though we have extensive breakdowns and make it easy for them.
So I will lead with my experience, which I'm biased. I had no choice. You better learn every aspect of the dental office. Um, but the other thing for me is, again, I'll go back to I had control issues. Um, and so I knew that if it would help me connect with that patient and help them understand, you better believe I'm doing it. Now, with that being said, is it going to be important that they're set up for success? Yes. And having that input ahead of time of not, hey, starting tomorrow, we're going to have you guys go ahead and start doing your treatment plans because that'll even get me wild. But I believe it's possible. I believe it's important. I do not want to rely on somebody else. If I have somebody in my chair that I can proceed forward with their treatment, I'm going to take care of that and I'm going to take control of that. If I wasn't set up correctly, then we could have a talk. But I'm not a huge fan of this isn't my realm because I believe at the end of the day, it's about the patient and their health. But
Love
figuring out
that.
how you can do it so that nobody's panicking or overwhelmed, that's going to be your bigger key.
Yeah. Awesome. There's some other questions that I got that are kind of floating around that, but so that I make sure that I keep in order of submissions. iPhone, so sorry, I don't have your name. iPhone said, I love that you mentioned intraoral photos when treating perio. That's an area I admittedly slack on, and it's so helpful for patients to see as well as getting the claims accepted. When do you use 4346? Are you bringing the patient back for a reval after, or is that only typically for gross debridement? Can 4346 be used every 6 months for a patient who persists with infection and inflammation but no bone loss?
Yeah, so what I would do with the 4346 is typically we would do a gross debridement, and on bias, to be honest, I liked the 4355 more because I was more familiar with it. But 43, 46, same thing. We would typically have them come in. There's no evident just bone loss going on. So what we would do is give them, whatever cleaning that they needed, and I would reevaluate in 2 weeks. And I would let them know that it is up to you. I need you, even if you haven't before, set an alarm on your phone because I let them know there are times where I just sucked at doing my home care because I was very honest. But I want them to do their home care, floss every single day or use a water pick for those next 2 weeks. I want to see how much inflammation we can get to decrease. I'll take their measurements again. That'll help me see, what they need going forward. So that's typically how I would do that. And then I would, alternate between kind of prophy and different things like that. But if they definitely were just periodontal, then I'd go to the more of the periodontal codes.
Okay. Jessica said, what are some examples you use the unspecified perio code for?
The 499.1 type of, yes. So, sorry. So how I did that with laser, because I used LBR and then I also used LAPT. Now, I like to track my numbers just because I'm in competition just with myself. Of course. So how I like to do is 499.1 and 499.2 because I did like to see how many patients the 499.2 was LAPT, 499.1 was LBR. So in a month span of time, I did like to go back and see how many patients did I do LBR, how many patients did I do LAPT. Because I will be very honest with you, there are times throughout my career where I was slacking. I was barely surviving, and it took everything in me just to get there, take care of my patients, and I knew that I wasn't doing what I believed in. So I would have to check myself. My sister would call me in, and it was so great having your family member be the person who would do like your review. It was fabulous. Always cried. But I would let them know ahead of time, I'm stuck in here. And I
Mhm.
already knew it because I just would have to have that just accountability almost with myself. So that's where I would use those two different codes.
Okay. Now I'm kind of curious to follow up with that. The point one versus the point two, did you ever go back like a year later and see which of those patients had a better success over like of either their numbers or even just like their show rate to their appointments?
Yes. And I think it's a mix. I think it's a mix of the education. And I
Yeah.
do also think it was a mix of they had to do an outside investment in their
Mm,
health. So I did think that that played an important role of, them coming back and then, saying, Lauren, we're not doing well this time. I need that laser. Or they really, once you start making an investment in your health, you tend to take it a little bit more seriously. So I think that did definitely increase with them showing up for their appointments and then being on board with their periodontal kind of protocol.
awesome. Okay. Um, I have had some offices that I've worked with in the past tell me, oh yeah, our patients ask for laser. And I'm thinking in my head, no, I don't. But I'm
Yeah.
so glad that that is actually like legitimately something that people ask for because they can see and feel the difference.
Yeah.
Okay. Sorry, did you have anything to add to that?
Yes, I mean, I would even have, I remember my one patient, God love him, he said it was like getting a massage. And I said, you're lying. Because I actually am terrified of the dentist. So I'm
I
like,
hear that.
getting clean by me is not a massage. He would come in and he'd say, Lauren, I need the laser. I was like, okay, well, you don't, but if you want it, it's not going to harm you.
Beautiful. Okay. Now, as I had mentioned, I will insert the link for the survey. So go ahead and open it on your computer. We have to make sure that we wrap up things. So for the continuing education survey. This is where you'll give us that AGD or license number for your CE credit that you have to give us your unique email to you. If you don't need the CE, we would still love for you to fill it out and tell us how we can do better. Or of course you can be like, Wendy, you're the best in the world. And I'm like, oh my God, thank you so much. But make sure that you open the link and save it, as we won't send it in the email afterwards. If you don't have a license number and you still just want to fill it out, just enter in 00000, and then your CE credits will be emailed to you within 3 weeks, and the form has to be filled out by the end of the day. Okay. There was one other question before I have another one. Do you use the D4999 for, can you see the chat? Hybenics? I don't know what that is. What is that?
What does it say?
Hybenics?
Oh, I want to know what that is.
Hybenx. Tell us what that is,
I want
Renee.
to know what that is.
Okay, then we'll go to another question while we're getting that answer from Renee. Let's see here. How do you set up the doctor for success without diagnosing?
What I would do is when the doctor would come in, again, we had to practice this one. Say, Lauren, were there any things that you were seeing of concern? And then I would go in. Here's the areas of concern. I did take a intraoral photo of this. It looks like there may be a slight fracture, but I need you to really help see if indeed or if that's just stain. I knew it was a fracture. I just know that those are the ways I went about. Here are my concerns, but doctor, you're the doctor. And I had many of those conversations with, I can tell you my concerns, but we call him the doctor for a reason. So that kind of was a way I did it.
Okay. Renee says that it is a Perio DT desiccation product.
Ooh, you gave me my next rabbit hole. Okay. You're always learning something new.
Isn't that great? That's my favorite part in dentistry is that there's always something new to learn,
Yes.
and not everybody knows everything about everything, even though they're like they're a specialist in a certain area. That to me, I think is phenomenal and why I'm always trying to rope people into dentistry
Yes. Always
as
learn.
a recruiter. Okay. Then we have a team member who's pushed back before about Perio. Do you have any ideas of how we can talk to this team member?
Bringing them on board in regards of creating the periodontal management protocol is going to be important so that they have a voice. However, at the end of the day, you have to have everybody on the same page because you can't have a patient see one hygienist and another hygienist says something completely different. So I'd be curious, always be curious first on the reasons why. And it's hard for me to believe when you are in health and when you are wanting to help patients that the reasons why or the curiosity behind the reasons why cannot be solved. And as you know, if you've worked in an office long enough, not everybody does have your same philosophy. And that is where you'd have to kind of figure out as the doctor who owns the practice, which my dad never did. He would send us in to do this because he hated confrontation. But just making sure everybody does have to have the same philosophy. So that's important.
And we had a hygienist retire after being in the office for a whole ton of years. We are seeing her patients now and realizing that there is a lot of undiagnosed perio. Do you have any words of wisdom for the hygienists that are seeing those patients as well as the patients that are now being diagnosed with perio?
Right. And this is you have to walk this line very carefully. Even if you see, an office, a patient from an office down the street, because you never want to throw anybody under the bus, but you have to treat health. So that is where I would say heavily rely on your intraoral photos, heavily rely on your education. If I knew I had a patient who was going to need a significant amount of education, I would let my doctor know ahead of time, and he was okay with me spending 30 minutes of that appointment. Now, did I do that with everybody? No. But 30 minutes of that appointment discussing what's going on. Healthcare is changing. Different things, like different ways of going about talking about what happens now, what they're presenting with now. I would typically say, have you gone through any stressful times in life? Different things like that, because everybody's stressed. So finding a way that you can do it without looking like you had maybe been under diagnosing or somebody had been, and taking really that team approach and starting new. You have to start new and treating what they have today.
Okay, another point, and this is my point. So I saw your slides before we got started today, and I wanted to kind of highlight and emphasize that I love the fact that you're saying that underdiagnosing is a liability risk and an ethical risk, right? I see most patients or most people, offices, hygienists, the conversations that I have, I see a lot of people that are fearing the opposite, that that they are assuming or thinking that they are at an ethical risk if they diagnose too much. And I talk with offices when I'm doing the onboarding process, and I ask, what's your percentage of perio? So many offices either don't know that number,
Yes.
or the number is nearly always under 15%, 20 to 15%. I don't ask any more questions when they say that they're, around 30%, because that's what I hear, is industry standard. So I hope that most people today have understood that is going to be like a rethink, is that if you are underdiagnosing, that is a liability risk, that is an ethical risk, and that we need to be diagnosing more. So I think that also kind of lends to the last question of, had a hygienist that retired after a whole bunch of years of working at the practice, and they were underdiagnosing, that maybe that could be an additional help for somebody's brain to make that positive connection instead of being scared to hear the wrong thing from a patient.
Right.
So
Right. I agree.
that needs to be like a quote. We'll try to pull that clip about the underdiagnosing and liability from what you were talking about. So fantastic. I loved it. Love it. Okay, beautiful. If anybody has any questions, feel free to send me a text, email, find me on socials. If anybody needs anything, I am here to help. I did also put in the chat earlier how to connect with Lauren, as well as the information for both of our sponsors for Practice by Numbers, as well as, of course, Wisdom, and that information there. Janet says, before we end here, majority of dental lawsuits are from failure to diagnose perio. Janet, you need to be on a webinar with me. Me and Lauren, if you, Janet, I don't know if you speak about this, I'm not exactly sure who you are, but send me a message, because if there's any information that I can provide to other people, or maybe even some of the people who are watching this today, they might be interested to learn more. Oh, hi, I know Janet. So I think that's a beautiful thing, and lovely to hear and understand that. Janet, you want to speak for just a moment?
No, I've always heard that. I'd have to, dig around to find the stat on that. But yeah, failure to diagnose perio, when people lose their teeth, and well, and nobody ever told me that. So, Lauren, you did a great job at explaining everything. But yeah, failure to diagnose perio is the main reason for lawsuits, for dental lawsuits. And I'd love to talk to you, Wendy, about either participating or contributing any way I can.
Perfect. Thanks, Janet. Okay, beautiful. Everybody, thank you for your attendance. I am so honored to be able to have hosted Lauren today and have our sponsors help out with today. So Practice by Numbers and Wisdom, and of course, Career Elevation. So if anybody needs any recruiting assistance, recruiting help, we are here to help if you need us. Thank you again, Lauren. Have a beautiful rest of your day.
Thank you guys so much.
Thanks. Bye.